Hello, everybody. Welcome back to another episode of the podcast Meet the Greek for Fred Hutch Cancer Center. I'm so excited today, thrilled to have a great friend and colleague, Dr. Rosa Nadal, who, Rosa, I think you're an associate professor here. You're a GU medical oncologist. Welcome.
Thank you very much, Petros, for the invitation. It's my pleasure to be here.
You know, it's my opportunity, Rosa, to practice my Spanish here with you, and the audience, can evaluate my Spanish. But muchas gracias, and quiero practicar mi castellano, right? I have to practice my Spanish.
De nada, tu español es muy bueno.
I have a good chance to learn more with you. So thanks again for joining us today. And I do this podcast, Rosa, to learn, from you and other great colleagues about, your journey so far, and of course, the amazing work being done here at Fred Hutch Cancer Center. Let's start by you giving us a little bit a brief overview of your journey, coming from Spain in the US and ending up in Seattle. Tell us about it.
So I'm originally from Spain. From Barcelona. I trained there as a medical oncologist, and after practicing few years in Barcelona, I thought that I wanted to do other forms of research, learn how American physicians and the American health system work, and do other forms of research. My mentor in Spain, Dr. Balmont, he has very good connections internationally, and he recommended and he just get me in touch with Dr. Eisenberger at Johns Hopkins. So Dr. Eisenberger was running a fellowship program for international graduates, and I interviewed there, and they took me, and I just joined the group. It was a super specialization GU fellowship program, and I met some of my, colleagues here in America that has helped me during my career. So after two and a half years in there, I decided to stay in the United States. So I thought that the best way was to, go again through official training and, kind of standardize my education to the U.S. standards. So I applied for fellowship programs, and finally I joined the NCI fellowship, medical oncology and hematology fellowship program at the National Cancer Institute, and I worked there with Dr. Apollo with the GEO group, and then I joined, when I completed the fellowship, I joined a cellular therapy and transplant group, because I wanted to get, the NIH has a lot, it's very well known for their expertise on cellular therapy. They have, they have been the fathers of the modern cellular therapy for solid malignancies. So I thought that it was a good opportunity, for me to learn a discipline that maybe not many medical oncologists have this expertise, like firsthand, like really working in inpatient floor, seeing cellular therapy and transplant patients, and working with a group with only that expertise. So I spent there 8 years, getting that expertise. And then finally I thought that it was time to move on and go to academia and use everything I learned there in, more like a academic, real world kind of setting. And at that time, Mike Schweitzer and yourself, during an ASCO-GU, mentioned to me that there was an opportunity to join the genitourinary medical oncology group at Fred Hutch, and I interviewed here. I thought it was, for me, a great opportunity because, both groups, the GEO group and, how famous is Fred Hutch for stem cell transplant and cellular therapy. And I interviewed, and, I got the position.
Rosa, we're so excited that you're here. And, one of the missions here for Hutch is to attract talent. And, when there's talent, we have to, go after it. So you're a great example of that. Tell us a little bit more about your ideas and vision about the cellular immunotherapy program. You're working hard with our friend Dr. Larry Fong in that regard, with fellows. There is a whole comprehensive program set up here for CAR T cells by specific antibodies, this cellular immunotherapy in solid tumors. Tell us more about it.
So when I was given the opportunity to work here, it was because they was kind of two needs. And, I thought that, I could do a good job fulfilling these two roles. One is within the genitourinary medical oncology group. And, there was a need for someone with some experience on bladder cancer. And I work on bladder cancer at the National Institute of Health and also at Johns Hopkins. And then there was a need for someone with an interest on cellular therapy for solid malignancies. And that was very timely because the immunotherapy group at the Bezos Clinic, led by Larry Fong, is looking for medical oncologists with this interest, and they are creating a cellular therapy clinic for cellular therapy and also other immunotherapeutics that has in common some toxicities that are associated to these immunotherapeutics, a clinic that focus on clinical trials on the development of these forms of immunotherapeutics for patients with solid malignancies. So Fred Hutch is very, very strong on hematological malignancies, stem cell transplant, and cellular therapy. And we are kind of teaming up with that already established group to build up a very strong group of oncologists with the same interest, but instead of hematological malignancies, solid tumors. That is what, my clinical practice is divided with these two areas. I have clinic with the GEO group, and I see bladder and prostate cancer patients, and I'm also helping to build up that program in the immunotherapy clinic. We already have some trials ongoing, in particular the STIP1 Carticel protocol for castration-resistant prostate cancer patients, but also other studies with BiTEs, with biospecific T-cell engagers for prostate cancer, and some of new trials that are going to be opening very, very soon that with immunotherapeutics for patients with metastatic bladder cancer and also testicular cancer.
So we talk about bispecific T-cell engagers. We have, Dr. Nadal, she's biphenotypic. We have, GU medical oncology expertise, cellular immunotherapy expertise, but it all comes together at the end, I think. Rosa, you implement those skills in one mission, helping patients, innovative treatments, access to those innovative treatments, generating knowledge. And you mentioned this, comprehensive program with Dr. Fong and colleagues. And of course, we have such an amazing translational research program at Fred Hutch. So amazing ideas that can be generated in the lab and they can be translated in clinic for clinical trials. And you have been part of that.
Yeah. So I have been working both with Andrew Shea, that he is a translational scientist. His lab focus on prostate cancer and also bladder cancer research, and also with Dr. Larry Fong. So his lab is very, very oriented to immunotherapeutics and development of immunotherapeutics in solid malignancies because of his background in GU malignancies. He has done a lot of work on understanding mechanisms of resistance to immunotherapeutics in prostate cancer and also in bladder cancer. So with, some of the work done by Dr. Fong that was very recently published in a very big paper, in a Nature paper, about myeloid resistant in metastatic castration prostate cancer, some work that he has done in the same line in bladder cancer, and also some of the work that our bladder cancer scientist has done with samples from our rapid autopsy program, our University of Washington rapid autopsy program. So we are working on a project that has been very recently funded with a bench to bedside award, where we combine enfortumab vedotin and pembrolizumab, that is an immune checkpoint inhibitor, with another agent that it is an adenosine pathway inhibitor. That the goal of this combination is to overcome some of the mechanism of resistance to immune checkpoint inhibitors. So the aim is to, that those patients that are not very, very sensitive to pembrolizumab, to that part of the combination of enfortumab, pembrolizumab, make them more susceptible to pembrolizumab, and that way increase the clinical activity of that combination for metastatic bladder cancer patients. Even if enfortumab vedotin with pembrolizumab is a very active regimen and many patients respond to that combination, the median progression-free survival is around 12 months. So some of the patients don't have a very long-term benefit. So that is unmet need. We need to understand how to prolong the duration of response in those patients that they seem that they don't get that full response to immune checkpoint inhibitors.
That's so exciting, Rosa. And I agree with you that we have made so much progress in the field for patients with metastatic bladder cancer, urothelial carcinoma, urinary tract cancers, and enfortumab plus pembrolizumab is one great example of this amazing progress, impressive improvements in outcomes, but we're not done. We still have way to go. We want to improve upon that, and we want to innovate and find even better therapies. And to your point, Rosa, how can we select in the future patients for more personalized approach, more customized therapy, finding what we call biomarkers to help us select patients? So your work is really important in that regard. Help us understand the mechanism why some patients have a great response, some others have some resistance to treatment. Let's figure it out and design the next trials and next therapies. Talking about next trials and next therapies, you already mentioned, a couple of trials you're working on. Can you tell us a little bit more about how we are working hard to get patients access our treatment as quickly as possible? Because I know patients, when they get diagnosed with cancer, they're really anxious, and rightfully so. So how are we working to enable faster access?
That's a very good question. And the reality is that I was very, very impressed when I joined Fred Hutch about this aspect and how the institution has fast tracked, the access to medical oncology care. For any form of cancer, not only bladder cancer, but I think for bladder cancer patients, there are three ways. Patients can be seen in our disciplinary bladder cancer meetings that happen every Tuesday, and in those meetings there is our urologist, our radiation oncologist, our nutritionist, patient care coordinators, nursing, medical oncologists, ourselves. And this is one way to gain, to get access to us. And there are two other ways. One is through medical oncology, GU medical oncology, and also through the immunotherapy clinic. So these are the three ways. The waiting time to be seen by a medical oncologist at Fred Hutch is only 48 hours. So patients can get a consultation with a GU medical oncologist with expertise not only in genitourinary, but also access to immunotherapeutics, access to phase 1 clinical trials in 48 hours. So I thought that was, at least compared to, what I was used, and especially maybe, back in Europe, I thought it was very, very fast access to care.
That's great. And I think that's so important, right? To have this opportunity to get patients and their families taken care of so quickly. And we're working as an institution, to your point, Rosa, to facilitate and enable faster access to patients and have a comprehensive approach. We take care of them with standard of care therapies, potential clinical trials. We have, of course, multiple expertise. And you mentioned already, Rosa, the multidisciplinary bladder cancer clinic and the multidisciplinary prostate cancer clinic in genitourinary oncology. There are similar examples of multidisciplinary care in other cancer types. Tell us a little bit more about this multidisciplinary care, how it works here at Fred Hutch and UW.
So I think it's a great clinic because patients come in the morning and they're seen by one of us, one provider, and then their case is discussed in a meeting where as I said, urology, radiation oncology, medical oncology, pathologists, nutritionists is a very large group of people that works towards, finding the best treatment and the best, supportive care for those patients. And then all these experts, they meet the patient and they discuss what are the treatment options, what is the best approach to their disease, what are the next steps. And if the patients opt to stay with us, we connect them with our own clinics. If the patients want to go back to the community, we let them community doctor know what was our assessment, our recommendation, and what the patient thought, also what was the patient preference. And, there is this communication with the doctors with the medical oncologists, the urologists in the community. Some of these patients, they get a mix, like flavor of that. They do some of the stuff, for example, they do, the urologic care in the community, but they come here for participation of a clinical trial, or they come here because, they don't have close to where they live a radiation oncology. So sometimes the care is mixed, but in the community, but here at Fred Hutch of University of Washington. But I think there is a very high level of satisfaction because in one morning they get, like a very big, comprehensive overview of, what would be the recommendation for the management of their disease. So I think this is great. This is great, and the patients have express a very high level of satisfaction. Also gives us the opportunity to interact with our colleagues in the community. Sometimes they don't need us at that point, but they know that we are here for them in the event that something does not go there, as we all wish, and they need further input. They need to come to us for additional therapy. So I think it's a very good setting, and it's a great meeting. And I think the patients really get a very, very, good service, like very comprehensive recommendations.
Very well said, Rosa. I agree with you. It's my favorite clinic in a way that I'm supported by amazing colleagues in urology, radiation oncology, pathology, radiology, nuclear medicine. We have nutritionists, we have social workers, we have genetics. We have a very interdisciplinary communication to optimize patient care, and I think that patients appreciate that kind of one-stop shop. And you have all this expertise, deep and broad expertise, focus on optimizing patient outcomes. So, and of course, looking at clinical trials that may be a good fit for a patient. So it's so exciting to be part of this team. Rosa, I'm really impressed with what you have accomplished in your first year here with our genitourinary team, our immunotherapy program, and I'm very optimistic about the future. And I want to leave us, here with the audience with this hope for the future. The present is bright, but the future will be brighter in terms of the innovation and the opportunities here for HATS. Again, for the audience, I'm Petrus Grivas, and I'm learning from my colleagues, my friends. And today I learned from Dr. Nadal about the great work he's doing. Rosa, thank you so much for the time today. And I appreciate you. More to come. For the audience, stay tuned, subscribe, and more episodes with Meet the Greek with many surprises are coming. Thank you so much, Rosa.
You are welcome, Petros. Thank you very much for having me.
Muchas gracias.
Muchas gracias.